Welcome to the Physical Therapy Playbook. These short modules are intended to help you get the most out of your physical therapy by better understanding what goes on in PT. I'm James, and I want to thank you for tuning in. You're taking a big step towards ownership of your recovery. Okay, let's get started. I want to start with why I made these videos, and it's three reasons, really. First, medical care is a lot. When we're injured and suffering, we often aren't sure the right path to take to get better. That can lead to less effective care and unanswered questions. Second, physical therapists are getting less and less time to spend with each patient to answer those questions. It's not fair to you, and it's frustrating to us. Because if we don't have enough time with you, we can't share all the important information that will help you get the most out of your physical therapy. So I decided it was time to do things differently and put together an organized guide to help patients with their own care. I've been a practicing physical therapist for over 25 years. No matter what problems my patients are dealing with, there are a few essential facts about physical therapy that I share with each one of them to help us get the most out of our time together. I'm going to share that information with you here in these three modules. It's basically a hack for your success in therapy. So let's get to it. Just a quick note, what follows is general medical information and is not intended to be used to treat any specific condition or diagnosis. I've organized this series based on the three main players in your care: the doctor, the physical therapist, and you, the patient. This module focuses on the doctor, or sometimes called the referring provider. Unless you came to physical therapy directly after surgery, at some point someone probably offered you physical therapy as an option for your recovery. Physical therapy may have been recommended by your family physician, an orthopedist, another doctor, a physician's assistant, or even a nurse practitioner. All of them can write referrals for physical therapy. If you're seeing a physical therapist without a referral, you could skip this video, but it may still have valuable information about how other members of the medical team can help you. This video will focus on working together with your referring provider to get the most out of their knowledge and skills to help your recovery. So as I mentioned, when we use the term referring provider, we're talking about the person that recommended you try physical therapy. Even dentists can make referrals to physical therapy for things like jaw pain and headaches. When you visited with your referring provider, he or she probably performed some sort of evaluation of your condition, a medical evaluation. Most importantly, the provider wanted to be sure that what you're complaining about is not a medical condition that needs more urgent medical care. Some medical conditions can trick us by causing symptoms that sound like they're coming from our muscles, bones, or joints. Kidney stone that causes low back pain is a good example. Once the provider is satisfied that you don't need medical attention, they will feel more confident referring you for physical therapy, where we will do a slightly different evaluation, but we'll get to that in the next module. Okay, let's talk a little bit more about your referring provider's role in your recovery. If the provider has a specialty in orthopedics, he or she probably provided you with a well-educated theory on what may be going on, like a medical diagnosis. Again, if you came to therapy right after surgery, the diagnosis sort of speaks for itself. I have a separate video on special considerations for recovery from orthopedic surgery, and I recommend you check that out if you are about to undergo or are in therapy after a surgical procedure. There's a lot of good info in there. So back to the medical diagnosis. This can be something specific like a calf muscle strain or something general like neck pain. The medical diagnosis helps the physical therapist plan your evaluation, and it also guides the care that the insurance company will pay for. In other words, if the doctor gave you a referral for neck strain, the physical therapist can't go around providing care for a different body part like your knee or your back without another referral for that body part specifically. Okay, another important role your referring provider plays is to decide if any medications could help or if there's a need for special imaging beyond x-rays like MRIs, CT scans, things like that. Regarding that imaging, often the doctor will wait to see how you do in physical therapy before recommending anything more than a plain x-ray. Lastly, your referring provider is really the overseer of your care. Ultimately, he or she works with you and your therapist to make decisions about general medical management. And we'll talk more about that communication in later slides. All right, let's talk about your doctor's role in a little bit more detail. Some referring providers may give you information about your problems so you can better understand the possible causes and general expectations for your rehab care. Not all doctors do this, but if they do, hopefully the information is useful for your recovery and provides you with a better understanding of what's going on. I've also seen some providers go so far as to actually hand out specific exercises. Typically, these exercises are appropriate for the condition the doctor believes you're dealing with, but may not be customized or adjusted to your specific needs. So, a couple of things here. First, the provider is definitely trying to help you, and the exercises are most likely not going to harm you. So, it's okay to give them a try if you understand the instructions provided along with them. Second, if you don't understand the exercises or if performing them increases your pain levels, I would strongly recommend that you hold off on the exercise and bring the instructions with you to your physical therapy appointment so we can go over them with you. Oftentimes, once your therapist evaluates you, he or she can adjust an exercise for better work for you, to work better for you. Personally, I often incorporate some of the doctor's recommendations into my patients' programs, but I also build a customized program around each patient's specific needs based on the physical therapy evaluation. We'll be discussing the PT exam in the next video, but let's get back to your doctor and how they feature in your recovery. During your care, questions for your referring provider may come up that you want answers to. They could be questions about continuing or changing a medication or whether a specific diagnostic test was ordered. These are questions between you and your doctor and will ultimately be decided by you and the doctor working together. I always encourage my patients to go directly to their referring provider with these questions and typically will not get in the middle of that. Remember, we want to make the most of our time for physical therapy during PT sessions, so it's often best if your medical questions are sent straight to the doctor. Personally, I communicate regularly with the referring provider to give updates on my patient's progress or to seek their input and guidance on your care. But when the question is about your medical management, that's best handled between you and your doctor. As for how you communicate with your referring provider, I strongly encourage you to set up and use your patient portal if your doctor's office has one. It's the best way to get messages through quickly and securely to your referring provider. You may have gotten instructions on how to do this at your first visit with the doc. If you don't remember, give the office a call and ask about it. They should be able to resend you the email or help you get it set up. Next, let's discuss follow-up visits with your referring provider and their importance and why you do them. Okay, we're close to wrapping up this module about your referring provider's role in your physical therapy care. The last thing I wanted to touch on is scheduling follow-up visits with your doctor, which I get asked about a lot. They're important for two reasons. First off, you should absolutely go back to see your referring provider, especially if it was someone you would consider returning to in the future for maybe another problem. That way their office can keep notes on your condition and treatment and how you responded to that treatment. That can help them in the future to decide a good path forward should you need treatment for the same condition or for something else. What if you were referred to physical therapy after going to an urgent care type facility? If you return to a place like that, I understand that you think you won't see the same provider you saw the first time. But if the facility takes follow-ups, you should still seriously consider making an appointment. The facility will keep records on your care in your file. Your follow-up with the referring provider is also a chance to discuss how PT is going. If physical therapy is not helping as much as we would have hoped, there may be things that the doctor can do that your therapist cannot. Things that can help you get more out of physical therapy treatment. This might include changing medications or ordering different tests and scans. As for when to make the appointment, setting up a follow-up visit for 4 to 6 weeks after starting PT makes the most sense. It allows some time to evaluate how effective physical therapy is so that you can then share that with the referring provider when you go back and see them. So that's a wrap for our conversation about your referring provider. In summary, the referring provider is the doctor, PA, or nurse practitioner who recommended you start physical therapy. He or she brings medical diagnosis and management to the team after performing their evaluation of your condition. Maintaining good communication with your referring provider is really important for each member of the team, physical therapists and patients included. Your physical therapist should be sharing information on your recovery with the doctor, and you, as the patient, should communicate directly with the doctor for any questions regarding your medical care. Make a follow-up appointment for about 4 weeks after you start PT so that the referring provider can hear how you're doing, evaluate your progress, and maybe make other recommendations based on how your recovery is going. Great job taking the time to better understand how to get the most out of your recovery and give yourself the best chances for success. If you haven't watched the other modules in this series, I'd recommend you check them out. There's a lot of information in there that you'll find helpful in understanding the rehabilitation process, the team, and your care. Also, check out my YouTube channel for other informative physical therapy videos as they're added.